Good morning, Mr. McGregor. My name is Linda, and I'm going to be your nurse today. We're going to take care of suctioning some of those secretions. I can hear them right now. And then I'm going to do a little trach care and clean up your trach dressing and clean you up a little bit. Is that okay with you? Okay, I understand you can't talk, so how about if you give me a thumbs up? Is that enough? Can you do that? Okay, thumbs up for yes, thumbs down for no. And if that gets to be too tiring, we can resort to blinking. Okay, let me check your name here. Owen McGregor, date of birth, April 10th, 1942. Is that correct? Thumbs up, great job. Okay, and it doesn't appear that you have any allergies. Do you have any allergies? You don't have an allergy band on. Nothing. Okay, great. No allergies. No allergies to chlorhexidine? Okay, nothing that you're aware of. Okay, I'm going to do a little prep over here, and while I'm doing that, you can just rest, and I'll get back to you real soon. Okay, I'm going to clean my hands. And put on some gloves. And clean the tray table down that's adjacent to the patient's bed that I'll be using to put my supplies on. Okay, and we're going to get the entire table in a very organized fashion, back and forth until it's completely clean. And all around the periphery. And we're going to let it dry completely. While it's drying, I will make sure I have all of my supplies. I need a trach care kit, a new inner cannula, which has the same size, an 8, as the patient's inner cannula, which is also an 8. A new trach stabilizer, a new suction catheter, some saline, and my emergency equipment in the room are 2 trachs, complete boxes full of trachs. One the same size as the patient has, which is the 8, and one smaller, which is a 6, and then a new inner cannula as a piece of emergency equipment that we're not going to use right now, that is the same size as the one that the patient has. Okay, it looks like the table is dry, so let me clean my hands again. And we do have to check our oxygen, which is part of our emergency equipment as well. The ambu bag is connected to the oxygen regulator. So this is the ambu bag, and it's connected to the oxygen regulator. And we're going to make sure that's turned all the way up so that we get 100% oxygen. And while the patient has a trach, we also have a face mask that comes with the ambu bag. We never want to get rid of that, because if something was to happen to the trach and we needed to bag the patient by face because the trach was occluded, we'd need to have a face mask. So we do have the oxygen that's ready. We also have, as part of our emergency equipment, the suction catheter, which is connected to this suction canister that should be emptied every night so that there isn't quite so much secretion inside here. it is connected over here. And when we turn this on, we're going to turn this until the dial hits between 100 and 120 millimeters of mercury. Now, I've just come on and I don't know when this was last changed. So I don't know if it's dirty or not. So I'm going to change it. We always want to leave one on there for emergency purposes, but I don't necessarily want to use that one if I don't have to. So we're going to disconnect this here, reconnect it here, and now my patient has a clean suction catheter. And this one we will dispose of. Also, this is the container that we'll use for saline so that we can moisten the catheter before we insert it into his trach. Let me put all of my supplies on the table now that it's ready. I'm going to open this up. And take out the glove. And then I'm going to take my inner cannula and drop that in. Okay, I'm going to clean my hands again and put some gloves on, and then I'm going to do my assessment after I pour some saline in here. Okay, so I'm going to pour some saline in here to moisten the catheter. And then I'm going to pour some more over here that I use for my sterile kit in the cleaning process. So I am going to take a listen to your lungs. And I cleaned my stethoscope right before I came in, so I know it's clean. Looks like your sats are about 94. So you probably need some suctioning. Take a big breath in and out. And in and out. In and out, in and out. Oh my goodness, you're very gurgly. Okay, Mr. McGregor, I'm gonna take your trach collar off and give you some breaths because your sats are a little bit down, and before I suction you, I wanna make sure you have enough oxygen. This face mask I would not need for Mr. McGregor because I'm not gonna oxygenate him through his face, but we do want to keep it around safely so that if for some reason his trach was occluded, I would have some means of bagging him properly through his face. So we're going to put this on. And every 6 seconds, give him a breath that lasts 1 to 3 seconds. Okay, looks like your sats popped up really quickly on that one. Okay. And now I'm going to test the suction catheter and make sure, oh, yep, it works really well. Okay, so again, it's set to 100 to 120 millimeters of mercury. And I'm going to place it inside the catheter, inside the trach, and advance it until he coughs or I meet obstruction. And then cover the suction and pull it back slowly. And this entire process should take no more than 10 seconds. Does that feel better? I sure got a lot out. Okay, good. Thumbs up. Do you feel like you need me to go down one more time? Okay, good. Then I'll just leave it like that and we'll move on. Okay, I'm going to put your oxygen back on so that you have some oxygen while I'm preparing the table. Okay, I am going to move the tray table a little bit so that I can put the side rail down and have better access to you. And then I'm going to come back and move my tray table back in place so that I can get to you. Okay, I'm going to wash my hands. Okay, and then put my gloves on. Now I'm going to move this a little closer. Okay, I am going to place the drape on your chest, and then I'm going to arrange the things in my sterile kit. So I don't need the brush and I don't need this, so I'm going to dump it away. Here's the Q-tips, which I'm going to put in the saline. This is the inner cannula. This is the split dressing that we're going to put on at the end. And 2 of these go in the saline and 2 of them are left here to dry. So, I'm going to remove your oxygen source and hold down the faceplate and remove the inner cannula. And come back and get the other one, touching only the top of it. Place it in and pinch the sides to clip it on so that's nice and stable. And then I'm going to remove this dressing. And I'm going to take the Q-tip and I'm going to clean underneath the faceplate with one swipe on the top and get the other Q-tip and clean with one swipe on the bottom. If you need more Q-tips, you can certainly get another package. And then this is wet, and we're going to clean the top of the faceplate with the wet saline filled 4x4. And we're going to use the other moist one just to clean around his trach and make sure it's nice and clean. And then we'll pat it dry with the 2 dry ones. And then we'll take the split dressing and place it underneath the stabilizer. Okay, now we are done with this part of the procedure. The only thing we have left to do is change the stabilizer. Okay, so I'm going to call a friend, and my friend has just arrived, and she's going to hold the faceplate down while I remove one side at a time and replace it with the new stabilizer. And as I'm doing this, I'm looking at the skin to make sure that his skin has not been excoriated from the moisture. Okay, and I'm going to shove all of this underneath his neck with the clean one and the dirty one. I'm going to, can you keep holding that and I will come around and do it on that side. Okay, I'm going to pull out his old one and pull through his new one. which of course has managed to Velcro itself. There we go. And you want to make sure you can put 2 fingers underneath so you're not choking them, but you also don't want it looser than that so that it's too loose and can potentially fall out. And of course you would then want to replace the oxygen source. And I will tuck this back under. And it looks like the back of his neck is in really good shape. Let me go back and snap it closed. Then our procedure is pretty much done. Okay, all we have to do now is just clean up our mess. And since he doesn't seem to need any more suctioning, I can toss out the rest of the saline to moisten the catheter. And I will let your guest back in, pull up the side rail. And of course I want to make sure that he has his communication device so that he can get hold of us since he's unable to speak. So here you go, Owen. I'm going to put this in your thumb and you can press that if you need it. I'm going to leave the towel on you so that in case that you cough at all, we won't soil your gown. Thank you very much for letting me take care of you. And then I would leave the room and go outside and document the date, the time, the condition of his skin, how he tolerated the procedure, that I only made 1 pass, had minimal clear white secretions. And that's it. Thank you very much.